Hey guys, it's Nina, the baby chick. I am here with our expert chiropractor, Dr. Elena.
Hi.
And today we're going to be talking about chiropractic care during pregnancy and beyond. I think that a lot of families or women, when they are pregnant, whenever I start talking to them about chiropractic care, it's something that, you know, they're like, is that going to hurt my baby? Is it safe? Is it just a bunch of cracking and popping? And they're not as familiar with the benefits. And so I thought it would be really cool to talk to our expert and kind of get a sneak peek of what it's really like and get some more information about chiropractic care. So all of our viewers, if you guys have gotten chiropractic care at all, or during your pregnancy, or after you had a baby, or even pediatric chiropractic care, which is something that Elena also does, we would love to hear your feedback and your thoughts and your questions. So we're live. You can ask questions. We have our lady in the back, Mary Alice, who will make sure to let us know if you guys have any questions. So we would love to have you participate in the conversation. So we're excited to have you. Please say hi. We love saying hi to all of our viewers. So don't be shy to jump on in. So anyway, I'm going to have my questions here to make sure that I ask all the great questions that you guys are wanting to know.
Well, I just want to say I'm super excited to talk about pregnancy and chiropractic. This is a passion of mine and my specialty, and it's the majority of my practice. So
really?
I encourage, most moms to see their chiropractor.
Awesome.
So
Yay.
ready for the questions?
Yes, absolutely. Okay, so like I was kind of initially saying in the beginning of our video is I think a lot of women are nervous that, is it safe to go see a chiropractor and get adjusted during pregnancy? Should I wait until I'm further along in my pregnancy? All of those kind of things. So can you give us more information on that?
Sure. So I always recommend to come in as soon as you find out you're pregnant, actually before you're even pregnant. It's good to have your spine in good alignment to make getting pregnant a little bit easier. But once you find out, go see your chiropractor and they'll plan a treatment plan for you throughout your pregnancy. So this is going to help to sort of like prevent any pain and then also get baby in good position. But is it safe? Absolutely. There's a specific adjustment called the Webster technique, which a lot of chiropractors practice. It is specific for pregnancy. It's a very mild adjustment and highly safe and effective.
Awesome. So you can go see a chiropractor before, as soon as you find out you're pregnant, all the way through. So is that something that people should be looking for and asking for? Hey, is that a certification that someone has to get?
So that's a certification is through the ICPA, which is the International Chiropractic Pediatric Association, and it's 12-hour training that we do. So a specific adjustment all weekend long that we're practicing and training with.
And that's something that you mainly do, like you said, with all of your clients since so many are pregnant.
Yeah.
Awesome. And definitely, and pediatric care, we'll have to do that another day because I think that that's so cool as well, that you can even come after you have a baby with your baby.
Oh, yeah.
It's so cool. I love that. I love that. Awesome. And of course, this always, goes away when I have my next question. So, perfect. Sorry, guys. 1 second. Okay. Perfect. So what can chiropractic care help with during pregnancy? What are the main benefits that, if someone is expecting that they want to, potentially help with?
So a lot of moms come in, they're sort of desperate because they're in so much pain that they're like, I don't know what else to do. Their OB is like, oh, we can't do much for you. We can't give you any medications at this time. So they seek a chiropractor. And most of the time it's for sciatica pain, which is that pain radiating down your leg. Also lower back discomfort and a lot of the round ligament pain in the front.
Yeah.
So moms will be
I think a lot of women don't even know that it's round ligament pain. They're like, what is this sharp pain?
I'm having all this this cramp or this sharp pain when I'm walking. Another common one is pubic symphysis pain. So the pubic bone starts to separate and that can cause stuff to kind of go out of whack. Super painful, and a lot of moms...
Very sharp, painful feeling kind of right at your pubic bone.
Yeah.
People have kind of explained that feeling, and we have said, hey, go see a chiropractor and massage. That can really help.
Yep, both of those, absolutely. So, we've had moms that could barely walk in here and they walk out of the office, which is amazing. So that's really our goal, is to make sure that you're feeling as best as you can during your pregnancy.
Right. And we always like to be realistic. It's not something that we think like chiropractic care, if you are completely doubled over and you're going to be 100% cured, feeling like all the way better after a treatment. Can you kind of tell us a little bit more of like realistic expectations and what people should do after an adjustment and how often maybe they should see a chiropractor?
So, it's unrealistic to think you may be 100% during pregnancy. I think that is actually realistic for a lot of patients, but at the same time, like, if your back is really messed up and you're having severe pain, you know, our goal is to get you through the day where you're able to like manage your pain, you're able to like do your activities of daily living, you're able to sort of like cook dinner for yourself,
right,
and like take a bath and all that stuff. So most of the time, most people feel better. Being 100% out of pain is definitely a possibility and happens a lot. But, you know, again, that pubic symphysis stuff is really painful. So it's not 100% every time.
Right.
But as for visits, you know, it depends what your chiropractor feels like you need. If you're feeling good and it's just maintenance-wise, we'll see you about every other week until you hit that 30-week mark, and then we'll see you about every week. Just to make sure you're holding your adjustments at that time. So it follows the treatment plan with your OB, sort of in line with
and
that.
you guys, most chiropractors accept insurance and will work with your insurance or something like that. So it can be something that is affordable.
Yeah. And if they don't accept insurance, they usually offer cash packages and everything. So there's definitely ways to like make chiropractic care affordable.
Perfect. Because that's, I think, something that moms are like, well, having a baby is so expensive anyway, but, you know, how can I make this more affordable? So that's really nice.
Yeah, and this is the time to splurge on your health. Like, you're caring for yourself and your new baby. And so I always am like, get your massages, get your chiropractic care, like, get your manis petties.
Yes. Tell your husbands this, ladies. Share this video with them. I agree. So something that I heard, and I want to know, I was told that if you go see a chiropractor regularly, especially also towards the end of your pregnancy, that it can help speed your labor, like make it a shorter time. Is this true?
So there has been research that's shown that chiropractic care does help to reduce labor time by 50% and also reduce the need for pain meds by 50%. And so the reason for that is if the pelvis is in good alignment, baby can get in good alignment and then come out the way they're supposed to. So if there's like a torque in the pelvis and baby's kind of stuck on something, it's going to make labor a lot harder and longer.
Yeah,
you know?
Yeah, and that's something that we see as a birth doula. We've seen so many times baby being in a position that just isn't working for labor, and it's prolonging the whole process, and you're trying to get baby in the right position, but you're right, sometimes women's pelvises aren't in the best alignment, or it just not ready to be able to get baby nice and low. And so I love that. I had no idea. 50%, guys, that's huge. So that in of itself is worth every penny. I think that's great. And I mean, you can kind of attest to that. You had your son. It was a quick labor, and
first
you've
baby,
seen
7 hours. I mean,
from start
6 pushes,
from start to finish, y'all. Like that's major. So I love that, and that's so cool. So perfect. So what can someone expect when they come to a chiropractor? Like, what can they expect during an adjustment session?
Okay, so your first visit, your chiropractor is going to take your history and do an exam. So this is a musculoskeletal exam. You'll kind of move around a little bit. They'll touch your pelvis and your low back and just check to see what's off. And then they'll kind of tell you what they're going to do for you. Okay. So I normally explain what I'm going to do during the Webster technique, which is a drop adjustment. So
do you want to kind of demonstrate that on the table?
Love to.
So we're actually at Elena's office. She's with she's the owner of Health Pro Chiropractic here in Houston, Texas. And so she's going to demonstrate on a table kind of what that looks like, so you have a better idea of what to expect if you were to go see a chiropractor. So
yeah, great. Okay. So normally, you know, if mama's a little bit bigger, we have some pillows here.
Great.
And so we have also like extra bolsters and things, and they can lay face down. Also, the middle part of the table drops out, so it makes even more room.
Perfect.
So we have lots and lots of options for mom to be able to lay face down, which is huge for her because she hasn't been able to lay face down in
a
months.
long time.
And so what the mom will do is kneel here and then lower her belly in here and have her head up this way.
Okay. Oh, y'all.
Good.
Oh, I don't have a belly, but oh my gosh, this is great.
Then your chiropractor will just do a leg length check. So we'll kind of see what side is off here. Nina's pretty good. Her right side is giving me a little bit more resistance than the left side, so that would be the side that I'm going to make the correction. And so what I'm going to do is work on her SI joint. It's that bony spot in your lower back here. And the way I do the correction is with something called a drop. So table goes up and drops down as I push right here. I'm not actually going to do the adjustment, but that's what you would expect. You would expect table to go up, a push, and then the table would drop this way. And then we do some light massage on the lower back and the glutes. We're working all the muscles that connect to your sacrum and your pelvis. And so when the pelvis is off, it can cause tension on those lower back muscles as well as some of the ligaments. So we'll work on the sacrotuberous ligament underneath the sits bones and in her glutes here. And then after we were done with that, you would sit up and then you'd flip over and we're going to check her psoas muscle and her round ligaments.
Okay.
So we do have a question.
Oh, perfect.
So Pauline said that she had a C-section and ever since then her back has been hurting her. Would seeing a chiropractor help?
Absolutely. So with a C-section, they cut open your abs and that's going to cause a lot of weakness in your core. And so the chiropractor can align your back to get you proper alignment and then also give you some core exercises to strengthen all those weak muscles.
So I think that's something that a lot of people don't know is that a chiropractor not only is going to help with an adjustment, but help you with knowing different stretches and exercises to do to kind of strengthen and get your body back to feeling good.
Yeah.
So awesome.
Great. And Ashley says, I can't wait for my appointment on Wednesday.
So am I
Yeah, she's going to lay face up and I'm just going to do a psoas check. So arms up above your head and palms together. And we just look again for a fingertip discrepancy. And her left side's off, which is pretty common since her right side was off. Her pelvis was torqued, which makes her left side a little bit shorter.
Okay.
So I'm just going to lift up her leg here and then release her psoas with some hip rotations. So that also feels really nice.
It does.
And then the last thing I'll do is check the round ligaments. So I'll feel here if she's having any pain or if I feel any tension, I'll just hold some pressure, do some light massage. And then if a mom's coming in with pubic bone pain, I'll check her pubic bone. So I'll just kind of feel and say like, is this hurting? Or if it feels off, then we'll make an adjustment. We can do that a couple different ways. We can do a little vibration, we can do a drop on this, or we can use something called an activator, which is a chiropractic tool to do the adjustment.
Right,
Okay?
right. Awesome.
And then you'll just roll over. We want to make sure everyone rolls over and then sits up so they're not causing more separation of the abs.
Perfect. Awesome.
So that's really it.
Perfect. Thank you for demonstrating that, Elena. I think a lot of people also think that it should be this big burly man that's going to do this adjustment, but I'm going to tell you, Elena has worked with some of the biggest men and has worked with them. So even these tiny little women can really get someone in a great adjustment. So I love that.
And I always end with exercises for my patients. So,
perfect.
and I have a handout for them, but it's a lot of like yoga moves that are appropriate for pregnancy.
Perfect.
Awesome.
Right,
and Rachel says that she loved getting adjusted while pregnant and it relieved so much of her back pain.
Aw,
So we
thank
love
you,
hearing
Rachel.
great feedback about chiropractic experiences.
Yeah, thanks so much for joining us, Rachel. Love having you comment, so thank you. Yeah, I think those were the big questions that I had. And how long is a session, like an adjustment session, can people expect?
Maybe about 10 minutes or so.
See,
it's
it doesn't
pretty.
take-
It's in and out. It depends how much work you need. You know, if you're really coming in for like maintenance care, the adjustment can be done in a couple minutes.
Perfect. So I love that. Okay, and then what are the benefits of seeing a chiropractor after you have a baby? Kind of like if someone had a C-section or even a vaginal birth.
Yeah.
What are things that can help the benefits for a woman after a baby?
So when you give birth, your hips are spread open and you might be squatting, you may be like laying on the bed, you may have not been able to move at all. And so that can put a lot of strain on your lower back and on your pelvis. And so it's good to get adjusted right after pregnancy. It's going to help to realign everything before all the hormones leave your body and everything sort of solidifies and gets tight. So I always recommend you see your chiropractor really as soon as possible, but within those first 6 weeks. Get alignment, and that will also help with future pregnancies to make sure everything's aligned properly so that you don't have issues with subsequent babies.
That's really good to know. So yeah, guys, I learned so much. I hope all of you guys learned a lot too. And if you are wanting to get some more information about chiropractic care, Elena is actually one of our writers at Baby Chicks. So she has a couple articles that you can read, and she's gonna continue to share some really great stories and information for all of y'all. So we hope that you guys stay tuned. Do we have another question?
Yeah, so Melissa and Yvette are both swearing by their chiropractors during pregnancy. And then Candace wants to know, do you have any tips for SI joint pain when pregnant? I see a chiropractor, but it's still so painful.
Are you doing exercises? Are you sitting on your birth ball? Those
Yeah.
are all things to sort of
Things
look
to
at.
ask. Yeah.
Tell your chiropractor. Be honest with them. Say like, hey, look, I'm still in a lot of pain. What else is there I can do? There's always kinesio tape or the rock tape, you know, like supportive tape.
Okay.
You can always get like a belly belt and things like that. But again, your chiropractor can sort of explain other treatment options if the adjustments are just not enough for you.
Yeah, I think a lot of people aren't also taking into consideration maybe their work environment. If they're sitting down in a chair for hours and hours, even that adjustment that you just did, it will kind of, you know, counteract with what you just did. So, so some women will have issues like that. So definitely, I agree with Elena. Ask those questions.
And your chiropractor can also tell you how to sit ergonomically correct for you at this special time in your life. So crossing legs really isn't good. You know, sitting legs open, letting your belly hang out on a soft surface is much better.
So, and she called it a birth ball, so a lot of people don't know what that is. It's essentially an exercise ball that you can get at any major store or even online, Amazon. So definitely get a size that fits your needs. Most people usually get 65 centimeters to 75 centimeters for their exercise or birth ball. So perfect. Guys, thank you so much for joining. We're going to continue checking this video for any additional questions and make sure to have Elena help us out if there are any answers that she can help us with. But again, we're so grateful that you guys joined us. We hope that you'll tune in next week. And I know that we're going to be sitting with Elena again soon, because something that I want to learn a lot more about is also pediatric chiropractic care. Because there's so many things that, even like briefly, what are some of the benefits that can help with pediatric chiropractic care?
Babies have been shown to decrease symptoms in colic, reflux, breastfeeding issues, latch issues, ear infections, tummy troubles, so a whole bunch of different stuff.
It's amazing. I have had so many clients where when I was their postpartum doula helping them with their baby, I recommended them to go see a chiropractor, and afterwards they were saying, oh my gosh, my baby is a new baby. They don't necessarily come out feeling, you know, in perfect alignment. They just were squished out. So seeing someone to kind of help them, and it's not a lot of cracking and none of that.
It's very, very gentle. It's as much pressure as you use to test a ripe tomato.
A ripe tomato. So very, very gentle. So it wouldn't be anything that you need to be concerned about. But anyway, guys, thank you so much for joining. Elena, thank you so much for having us. And we will see you guys next week. Bye.